Esophageal strictures are a condition characterized by the narrowing of the esophagus, the tube that carries food from the mouth to the stomach. This narrowing occurs when scar tissue forms in response to inflammation, injury, or damage to the esophageal lining. Over time, this scarring causes the esophagus to become constricted, making it difficult for food and liquids to pass through. Esophageal strictures can lead to significant discomfort and complications, such as malnutrition or dehydration, if left untreated. The condition can affect people of all ages, although it is more common in adults, particularly those with chronic gastroesophageal reflux disease, GERD. There are different types of esophageal strictures, typically categorized based on their causes. Peptic strictures are the most common, resulting from acid reflux in GERD, where stomach acid damages the lining of the esophagus, leading to scar tissue formation. Malignant strictures are caused by esophageal cancer, where a tumor blocks the passage of food. Radiation-induced strictures occur in patients who have received radiation therapy to the chest or neck, leading to fibrosis and narrowing of the esophagus. Caustic strictures result from ingestion of harmful chemicals, such as acids or alkalis, which cause severe injury to the esophagus. Other forms of strictures can occur due to congenital defects, autoimmune disorders, or surgical complications. The main causes of esophageal strictures include chronic GERD, which accounts for the majority of cases. Repeated exposure to stomach acid can erode the esophageal lining, leading to scarring and narrowing. Other causes include swallowing caustic substances, trauma or injury from medical procedures, radiation therapy, and underlying diseases like scleroderma or esophageal cancer. In rare cases, strictures may be congenital, meaning they are present at birth due to abnormal development of the esophagus. Several risk factors increase the likelihood of developing esophageal strictures. These include long-term GERD, especially if left untreated, as persistent acid reflux damages the esophagus. Individuals who undergo radiation therapy for cancers of the chest or neck, as well as those who have had surgery on or near the esophagus, are at higher risk. People with autoimmune disorders, such as scleroderma, which can cause hardening and tightening of tissues, are also susceptible. Additionally, individuals with a history of ingesting harmful chemicals or those with esophageal cancer face an increased risk of developing strictures. The symptoms of esophageal strictures typically include difficulty swallowing, dysphagia, especially when consuming solid foods. As the condition worsens, even liquids may become difficult to swallow. Patients may experience a sensation of food getting stuck in the throat or chest pain, heartburn, regurgitation of food, or unintended weight loss due to difficulty eating. Some may develop coughing or choking episodes during meals. These symptoms can significantly affect quality of life, causing discomfort and anxiety during mealtime. The treatment for esophageal strictures aims to widen the narrowed esophagus and manage the underlying cause. Esophageal dilation is a common procedure where a flexible tube with a balloon or dilator is passed through the esophagus to stretch and widen the narrowed area. This procedure may need to be repeated periodically, depending on the severity of the stricture. Medications such as proton pump inhibitors, PPIs, are often prescribed to manage GERD and prevent further damage to the esophagus. In cases where strictures are caused by cancer or other diseases, additional treatments like chemotherapy, radiation, or surgery may be necessary. Surgical management is considered for severe cases of esophageal strictures, particularly when less invasive treatments like dilation are not successful. In cases of malignant strictures, surgery may involve removing the tumor and part of the esophagus, followed by reconstruction to restore function. Esophagectomy, the removal of a portion or the entirety of the esophagus, may be required in some cancer cases. For benign strictures, surgery may involve removing scar tissue or creating an artificial passage to bypass the damaged area. Post-surgical care is crucial, and the patient may need to follow a modified diet during recovery. A nursing care plan for patients with esophageal strictures focuses on symptom management, ensuring proper nutrition, and preventing complications. Nurses play a key role in educating patients about dietary changes, recommending soft or pureed foods that are easier to swallow. They monitor patients for signs of malnutrition or dehydration and may assist with feeding tubes if necessary. Pain management is essential, especially after dilation or surgery, and nurses work closely with patients to manage discomfort. Psychological support is also important, as patients may experience anxiety related to eating difficulties or their diagnosis. Subscribe us for more videos like this and visit bazaarbiblio.com for notes and free PDF books. Thank you.